Hi, my name is Jesse. I'm from San Antonio. I care for my older sister who has Down syndrome. I have cared for her for most of my life, and more so recently, ever since my mom became disabled.
My name is Christina. I am from Oakland, California. I care for my father who served in Vietnam and suffers from PTSD and lives with MS. I would say the greatest challenge as a caregiver has been that I don't fully know how to support him physically and emotionally. He's a very private and closed-off person, and so his physical limitations make it harder for me to evaluate how I can actually help him. He's also a proud person, so his mobility restrictions have been a struggle for him and I.
What is my greatest challenge as a caregiver? I struggle with the guilt of it all. Not being able to be there as much as I should. My job requires me to be on the road a lot, which means that I have to be away from my sister and the care that she needs. And so now that I can't rely on my mom, how do I provide the care that she needs? The guilt of not being able to be there full time.
Hello there. I'm John Shaw, CEO of Caregiver Action Network. Today, there are more than 90 million Americans caring for a loved one in this country. Those family caregivers express the full spectrum of caregiving. Some are caring for an older loved one. Some are caring for a child with significant health care needs, such as autism. Some are caring for a family member, a friend, a spouse, or a neighbor with a disability or chronic condition like Parkinson's or MS. Caregiver Action Network serves those across the full spectrum of caregiving scenarios. Some are new to the caregiving role. Some have been caring for their loved ones for many years. One thing holds true across all caregiving situations. Family caregivers are vital. So whether it's a brand new family caregiver or someone who's been at it for years, Caregiver Action Network is there to help. I believe strongly in the work Caregiver Action Network does, but it's also personal for me as CAN's CEO. I'm a long-distance caregiver for my mom in Michigan, so I fully understand the challenges and stresses of ensuring that your loved one is well taken care of, even when you can't be there. I understand the need for information and updates so that I can rest assured that my mom is doing well. The stories you just heard were family caregivers talking about the role they played in caring for their loved ones. In this upstream training module, we want to dig a little deeper into the needs of family caregivers whose loved ones are living in a long-term care community. And we want to look at and talk about the ways they continue to support their loved ones. That is ultimately beneficial to you as the care professional or any professional care provider. I want to give you some clarification on a couple of the terms I just now used, because you'll continue to hear them throughout this module and the other 3 modules included in this series. When we use the term long-term care community, we're talking about a variety of settings, including nursing homes, skilled nursing facilities, and assisted living facilities. The term care professional is used to identify any and all of the staff at those facilities, including but not limited to medical staff, nurses, administrators, social workers, case managers, and patient and family advisory committees. Before I turn it over to Jessica, who will dig deeper into this information, I'd like to recognize our sponsor, Omnicare Pharmacy, a CVS Health company. Their support allows us to bring this information to you.
Thanks, John. Before I get started, I want to mention that this module is one in a series that can all be accessed at caregiveraction.org/omnicarepharmacy. The topics of the other coordinated modules include Why family caregivers matter, the critical role of family caregivers in transition of care, and what family caregivers want and how they can support care professionals in long-term care communities. Let's start with the obvious. Caregiving in any of the described scenarios isn't easy. It can also have a negative impact on the family caregiver's health. It can strain relationships within the family, and these relationship dynamics can cause the coordinated care of the loved one to suffer. Caregivers that work may find it increasingly difficult or impossible to juggle their careers and responsibilities in caring for their loved one. To put this as succinctly and as bluntly as possible, caregiving takes a tremendous toll physically, emotionally, and financially, and you as the professional care team need to understand where those pain points exist. Let's first take a look at the impact that caregiving has on physical health. Family caregivers report having a chronic condition at more than twice the rate of non-caregivers. Some examples of chronic conditions they may be faced with include cancer, COPD, diabetes, and many other cardiovascular diseases. Now, in using the example of spousal caregivers, we have to note the increased rate of mortality amongst caregivers. When a wife is hospitalized, the husband's chance of dying within a month increases by 35%. This according to a recent study conducted by Amplion Clinical Communications. Reversing that situation, a wife's mortality rate increases by 44% when her husband is hospitalized. Next, we want to explore the impact on a caregiver's emotional and mental health. Family caregivers are 2 times more likely as non-caregivers to experience symptoms of both depression and anxiety. To dig into that data a little deeper, we're also able to see that specific demographics are impacted by depression and anxiety. Again, to use spouses as the example, in that same study, it was reported that wives caring for their husbands experience depression at a rate that is 6 times higher than non-caregivers. To put a little more context around this, these are all factors that you want to take into account when engaging the family caregiver and considering the place they may be coming from and how they may be receiving information and updates. In the module, Why Family Caregivers Matter, we explore how family caregivers are a wealth of helpful information about your resident. It's important to build that relationship so that you can gather helpful information from them to better do your job. It's also important to understand that these mental health issues may be at play, and knowing this or observing indicating behaviors may help you to better tailor your approach and any coordination with them as it relates to the resident you are caring for. Related to these mental and emotional health issues, it is important to discuss caregiver isolation. What do I mean by caregiver isolation? It's what happens when the duties of caregiving have seemingly taken over the caregiver's life. There is no longer the time or energy or other resources necessary to do any of the activities enjoyed prior to becoming a family caregiver. Friendships and other relationships within the family commonly fall off. Caregivers can become disengaged from work, school, or extracurricular activities or hobbies. The areas where the person may have drawn a great deal of joy can become totally obsolete. We can also connect social isolation back to impacts on physical health. There's a growing number of studies showing that individuals experiencing loneliness and isolation are more likely to develop chronic conditions and increased risk of death. So, as you see, with each of these examples, there is a great deal of interconnectivity and overlap when it comes to the health of the caregiver and the impact on the level of support they can provide you in doing your job. Earlier, we talked about the difficulty that family caregivers have in balancing their duties at work and home. In looking a little closer at this, first, there are the substantial out-of-pocket expenses that the family caregiver is likely incurring. Every situation is different, but in many cases, this can be impacting other parts of their life where they may be cutting back and making adjustments. This can be tied directly to some of the mental and emotional health struggles that we talked about. These out-of-pocket expenses can include things such as incontinence supplies, nutritional drinks, or other specialized diet supplements, bandages, and other supplies that are used to treat wounds. Something a little less obvious includes things like fuel in the car to go back and forth to medical appointments. These are just the tip of the iceberg, but examples of things that caregivers commonly pay out of pocket for, and those costs can add up quickly, to the tune of an estimated $10,000 per year. Now, we've talked about how one need of family caregivers is for others to understand the toll of caregiving, physically, financially, and emotionally. This leads us to another area of need for family caregivers, connecting with others that are or have been family caregivers themselves. These connections are crucial for two reasons. First, there's the benefit of being able to connect with someone that knows what you're going through, as a means to possibly find some solutions to the many challenges they are likely facing. There are often situations where someone may not have felt comfortable putting voice to some of these challenges before, and having this outlet can be vital. Second, this also helps to address the issue of social isolation. Whether it's finding a local support group or joining an online forum, it can alleviate feelings of loneliness. We hear from family caregivers all the time that none of their friends understand what they are going through, so they don't even talk to them about their struggles. The same can be true of certain family dynamics, where one sibling or family member may live near the parents or loved one in need of care, so they are in a position where they are the primary caregiver. Their day-to-day lives and struggles can look very different and can lead to a disconnect. What we see is when family caregivers talk and connect with others in their same position, it allows their feelings, both positive and negative, to be validated, leading them to feel not so alone and isolated. It's common for there to be hesitation to attend one of these group meetings, so encouragement from you, the professional, can help them to take that step. At the end of the day, them taking that step and finding more emotional balance helps to make your job easier and making any required coordination more effortless. And that brings me to the final need of family caregivers, the need for information. We're all familiar with the idea or the phrase that knowledge is power, and that is absolutely true when it comes to caregiving. Where do family caregivers get their information when their loved one has transitioned to a long-term care facility? The answer is the care professionals at the long-term care community that interact with their loved one daily. They want updates on their loved one, like, have there been any notable changes in routines? Have there been any changes in symptoms? Family caregivers are a part of the care team and pivotal in making decisions around their loved one's care. This information allows them to make the best decision possible. It also allows them to continue to feel connected to their loved one, even if they don't see them every day. Here's an example of how this might look. Let's say I am my mom's primary caregiver, and she has been living in an assisted living community for just over a year. I always bring Mom her favorite candy when I come to visit. I noticed when I visited her last that her candy dish was still full from the previous visit. I have regular check-ins with the staff, and they let me know that she had started taking her roommate's licorice. I asked Mom if she wanted me to bring her licorice instead of chocolate next time I come, and she said yes. I feel better knowing that there wasn't perhaps a more serious reason she had stopped helping herself to a few chocolates here and there. She had simply found something that she liked better at the moment. So, we hope the information, stories, and scenarios in this module have outlined clearly the impact that caregiving can have on those supporting their loved ones. We want one of the key takeaways to be a better understanding that family caregivers need to feel heard and connected with each other. Each family caregiver and their scenario is unique, but the impacts and needs can be universal across all demographics and scenarios.
The greatest reward of being a caregiver is just knowing that I can be of use by helping my sister and my mom maintain some independence. It's just small things, by being able to let them both sit out on the back porch together and look over this lake that they used to be able to walk around together, and that they can still sit there and enjoy looking at the lake. So that they can be there together and enjoy it. Think of the memories of being.
The greatest reward for me as a caregiver is probably being able to support a man who proudly served his country and his family. And in really frustrating times, I try to remember the sacrifices that he went through, and I try to put it in context of whatever inconvenience or obstacle that might be in my way.
The one piece of advice that I would give to caregivers would be to remember those special moments from your life that you've shared with those loved ones that you're taking care of. They can really help you through those tough moments. It reminds you of why you do it. And
my one piece of advice is to try to remember how you yourself would want to be taken care of at that age or in a similar situation.
Thank you for checking out this module. We hope that the information we've shared today, and the stories from family caregivers, has furthered your understanding of what family caregivers need. We all know that caregiving comes packaged with a fair amount of challenges and stress, and knowing the sources of those pain points can be incredibly important in building relationships with the family caregivers of your residents. Be sure to connect with Caregiver Action Network on social media and visit caregiveraction.org to find more information and resources for family caregivers, including our Caregiver Help Desk, a tool that connects family caregivers with caregiving experts via phone, chat, or email to find answers to difficult questions and be heard.